Many people have had a moment, a lump, a strange mole, a cough, and they wonder, could this change the trajectory of my entire life? I had one of those moments when I noticed a lump on my neck. It immediately made me think about what matters to me and how I wanted to live my life. As a quality improvement professional working within a large primary care network, I know the importance of cancer screening. My lump was noticeable, but I know that isn't always the case. Preventative cancer screening is a large part of what I promote in my role. So, when I found out about a new colorectal screening initiative that would provide FIT kits directly to primary care clinics, I was immediately on board. I wanted to make it shiny and exciting and show how this project checked all the boxes, but at the same time, I was mindful of how busy primary care clinics can be. I knew I'd have the most success pitching this idea to an innovator clinic, and was delighted when they immediately said, "Yes, we want to do it." They saw right away that it would improve care for their patients. At the next meeting, we began to lay out the entire process. How do we make sure the EMR notifies the team when a patient is due for screening? I agreed to work with our PCN EMR consultant, and Kim, the panel management assistant, said she would ensure the charts were up to date. Who would print off the requisition and explain the importance of colorectal cancer screening? Well, Dr. Hamilton said he could take that on and use his clinical judgment to ensure that screening was appropriate. Who would maintain appropriate inventory? Sue, the medical office assistant, agreed to keep a list at the front, and Maria, the clinic manager, agreed that she could take on the task of ordering kits from the lab. What about patients who weren't coming into the clinic? How would we reach them? Kim said she'd call and invite them to come in for an appointment with a team member. Who would do the reminder phone calls? Kim could do this too. Over the next few weeks, all the logistics of this simple QI project slowly came together, and there was a sense of anticipation when the FIT kits finally arrived. Would all of this really improve screening rates at the clinic? A couple months later, I was chatting with Kim and casually asked how the project was going. Well, so far, I'm surprised by how few reminder calls I've made, and I can already tell that more patients are getting their screening done. It wasn't until we pulled data from the EMR at the end of the pilot that we realized how effective it really was. Of the 47 kits that were given out during the study period, 39 results came back. It was minimal effort, high impact. The lump on my neck is benign, but my healthcare team is proactively monitoring it. It is comforting to know that they're watching out for my health, and I'm sure that all the patients who received a FIT kit feel the same way. There are still a lot of process tweaks needed to ensure the long-term sustainability, but we know that reducing barriers by having the FIT kits in the clinic is so important. It literally saves lives. And based on the numbers from this one clinic, there is a very good chance that we already have.